Hello, everybody. My name's Bernie Harrison. I'm the director of the ACHS Improvement Academy and also an adjunct associate professor in the School of Public Health Faculty of Medicine and Health at the University in Sydney. So it's great to be talking to you today about a very exciting program that we're bringing to you called the Virtual Quill Program. As you know, we've had a very successful quality improvement lead training program, which many clinicians have around Australia have undertaken with us. And as you know, last year, due to the COVID pandemic, we moved a lot of our offerings to virtual, and we are delighted to be able to bring the Quill program to you in the first half of this year as a virtual training program. So I've got a very short information set of slides to provide some information to you. So these are the objectives of the program, and our overall objective is to continuously improve the quality and safety of healthcare for the patients that we serve. So that's our big mission here. Throughout the program, we're going to be looking at international best practice and benchmarking that to Australian quality and safety initiatives. We'll be looking at skills in quality improvement science, a long, rich history of improvement that is in many industries, goes back 100 years. Skills in quality improvement tools. How do we practically take a problem and solve it using really good improvement tools? Skills in prospective improvement tools, particularly around patient safety, human factors engineering, reliability science, and failure modes effects analysis. Very importantly, we'll be looking at measurement for improvement and using really good, robust methods, specifically statistical process control, charting, and how do you create those measures and how do you interpret that data to help you drive your improvement efforts. Skills in microsystem change, and specifically plan, do, study, act, and how do we do these rapid cycle iterative tests of change to drive patient safety and quality improvement. Principles of patient and consumer engagement, and particularly we'll be looking at practical approaches to patient-led improvement and patient co-design. Very, very exciting. Understand principles of change management, spread and sustainability, incredibly important when we're doing a big systems transformation is how do we take everybody with us? So that's a really important piece of this. Leadership and teams, very, very important again. So what's the attributes of very high performing teams and specifically high performing improvement teams? And finally, we round this all off with the leadership and high level governance responsibilities for quality and safety as laid out in Australia under the new standards and the clinical governance framework. So that's a lot of objectives. So how will we be doing this? So we have divided this content up into 5 modules. Each module will run for 3 hours in the morning, and they'll be on a Thursday and a Friday. And as you can see, the first 4 modules are about a month apart. And then we have what we call a project phase because yes, to graduate from the course, you need to undertake a small quality improvement project to put all this learning into practice. It really is the best way to learn. So as part of this course, you will receive 36 hours of interactive teaching with an expert, 16 hours of coaching, particularly around your own improvement project and some leadership things that you might need assistance with, email supports, which will be coming from us here at the Improvement Academy, quality improvement project support. So practical things like the diagnostic tools and maybe some assistance with measurement. And of course, you get to network with peers from across Australia, which is just an incredibly valuable thing to do. So this is how the modules are divided out. So you can see of the content, what's being taught in each day. Obviously, if there any modules you can't attend, we are offering makeup sessions. That would be through as an exception though. And then we've got the final module 4, then we do module 5 and then our graduation. So that's our project phase, 4 months, which is when you do your projects. Now we've got a wonderful faculty here. All of them have academic publications, hands-on practice at doing quality improvement. And of course, our mentor and guide has been Professor Brent James from Intermountain Healthcare, in being very generous and sharing his learnings and teachings with us and his methods. So that's our wonderful faculty. So program cost. So the total cost of the program is $3,500 for everything that I've just described to you, which is fantastic value. We've got a few payment options, however. We've got, if you register for the full course in one go, and we use the Eventbrite paywall, and that links directly into Zoom, so the system is completely integrated and automated now for us, we will offer a 10% discount. We're also offering a 20% discount on the 3,500 for organizations who send 3 or more. And that works out at a price per head then of 2,835. Now we are offering payment in installments. This is particularly relevant for people who want to self-fund. So just before each module, you register for those modules, and that comes to a total fee of 3,500, but you get to pay that over the 9 months of the program. So for more information on this, you can either email us at improvementacademy@achs.org.au or visit us at www.achs.org.au/Improvement Academy. And when you go to that webpage, you can go to the information about the virtual quill program, and also you can register there. All right, so thank you very much, and hopefully we will see some of you on the course.